My name's Clare Rayner, and I am a member of an organizing committee that has worked on again, off again for a couple of years to organize what we hope will be a grand display of our nursing programs here at St. Lawrence College. I would like to introduce you at this time to the other members of the committee that work together. Margaret Smith, who's retired faculty, and who was our last Dean of Nursing. Ruth Doran, there at the back, okay. Patty Cox, June Nayland, Pat Neckus, and Donna Davidson. These are the retired people who gave up their precious retirement to come and meet with me every couple of months. And so the current faculty and staff are Gwen Doon, Tabitha Rutledge, Susan Anderson, and Sil Ferrucci. So, also from the alumni office, and somebody that has really carried the ball for me, especially these last few months, is Janine Foster from the alumni office. And from educational media, a big round of applause for all her hard work with all these displays is Deborah Daylock. Our partner for today's event is the Museum of Healthcare at Kingston. I would say it's probably about 5 or 6 years ago that Dr. Lowe then was the executive director of the museum, and Paul Robertson, who at that time was the curator of the Healthcare Museum, had a vision. 5 schools of nursing, the 3 original hospital-based schools, and the 2 current facilities in educational institutions, St. Lawrence College and Queens, should each be highlighted, 1 per year, and so the Kingston Nursing Education Past and Present project was born. Dr. Lowe called me up one day, and I was in a weak moment. I said, yes, I would join this group. It's been a fascinating journey, I must say. Met lots of great people, and have seen lots of great schools of nursing put on their display. The first year, the KGH School of Nursing was on display. The second year was the Hotel Dieu. This year was the year I chose because I knew it was going to be the 40th anniversary celebration. Next year, I think, will be the Kingston Psychiatric Hospital School of Nursing, and in 2015 will be Queen's School of Nursing. Okay, so it's now my pleasure to introduce to you the MC for today's program. When I first met Paul Robertson about 5 years ago, he was creator of the museum, and we worked on a project to tell the story of the KGH School of Nursing, whose student body, me amongst them, lived in the Anne Bailey residence, which is now the Museum of Healthcare. It was much of a museum in those days too, when I lived there. Paul and I used to go around to retirement homes and visit KGH grads who were living in retirement homes, and we would hear their stories about what it was like a student nurse sometimes 70 years ago. Some of the grads we entertained were well into their 90s. And so we'd hear some pretty fascinating stories from them. Since that project was completed, and you'll see the results of it when you visit the museum later on this afternoon, the Nursing Education Project was born. Paul, who holds a master's degree in Canadian history from Carleton University, came to Kingston in 2004. Leaving a position in Ottawa at the Canadian Museum of Civilization. More recently, he has worked with art curator John Allen at the Agnes Etherington Art Centre to create the dynamic and inspired exhibit entitled Friendly Fire. This is a contemporary artist's take on conflict and medicine during the War of 1812. In 2012, Paul left the Museum of Healthcare to become the city curator of the City of Kingston, where he oversees the city's civic collection and the 2 municipal museums, the McLaughlin Woodworking Museum and the Pump House Steam Museum. and he also works hard to interpret and tell the stories of Kingston and her citizens. It's my honor to ask you to join me in welcoming Paul Robertson.
Thank you, Claire. When you work with Claire, it's always exciting. And doing the interviews with the retired alumni of KGH in a project a few years ago when we were developing the original Nurses Gallery at the Museum of Healthcare, it was an exciting journey, let me tell you. It was the stories of those nurses and their times were fascinating. But working with Claire as the liaison, the link between all of those elements was sort of the thread between each was a real experience for me. And one thing that became very clear is that the way nursing is done may change over the generations, but that bit that's inside you, that never changes. And speaking to a nurse who graduated in the 1930s versus one who graduated this year, elements are always the same. It's an honor to be asked to be the MC again this year for this, I'll call it the Continuing Festival of Nursing. It's third year, and it's a real delight to see many of my alumni colleagues from KGH and Hotel Dieu, as well as so many young faces who are in the ranks here at St. Lawrence now. It's exciting. The tradition certainly continues. I bring greetings from the city of Kingston, where, as Claire said, I'm now city curator. And one of my jobs as city curator is to collect not only the tangible history of this city and municipality, but also the intangible history. And that's very much what this exercise that brought you here today is doing, and that what the Museum of Healthcare, helping to organize this 5 years in a row with the celebrations of nursing at each of the nursing schools here in Kingston. It's very much about collecting the intangible stories of those schools and ultimately of the community in Kingston. And I thank you for being participants in that process, and my wish is for it to continue. We have several speakers who will speak to you briefly today that I will introduce, and then there'll be a couple of video presentations which I look forward to because I haven't seen them. So I will introduce each of them in turn. I'm happy to introduce to you Glen Vollebregt, the current president and CEO of St. Lawrence College. The Board of Governors of St. Lawrence College welcomed Glen as the new president and CEO in January of this year. With 12 years of dedicated service on the college's executive team, Glen brings a broad range of senior administration experience, a proven financial background, and a passion for student success to this leadership role. Glen holds a Master of Science in Public Policy and Management from the University of London in the United Kingdom, and a Certified Management Accountant designation and a Business Accounting Diploma from Georgian College. Please welcome Glen Vollebregt.
My bio is longer than my speech. So welcome everyone. Very, very pleased to be here, thrilled to be here, and on behalf of St. Lawrence College, I want to welcome you back to this beautiful place. It's great to be celebrating Nurses Week, and in particular the 40th anniversary of transitioning the hospital schools to the college system. It's great to see the wide variety of folks here as well. And I was, looking at all of the poster boards and having some laughs. Actually, there's some great shots there. But one thing that caught my attention is how many students are here today? Put up your hand. So, wow, that's great. That's fantastic. But there's an interesting little piece over there where in the 70s, it was the registrar asking for your student tuition fee, and it was a grand total of $125. How things have changed. The transitioning of the hospital schools was a big step, obviously, for colleges, and I was chatting with Mark Smith. Hi, Mark. Mark's in the back there. and commenting on the fact that at that time, what that also brought was an incredible wealth of faculty experience to the college, which was really relatively immature at that time. It was 5 years old. I guess immature might not be the right word, but as a 5-year-old institution, the nursing faculty that came over brought this incredible amount of wealth and expertise. The college has a long history of nursing, and one of the things that we like to talk about at the college is that if you take all of our nursing programs and our allied health programs, almost 40% of our enrollment is in the healthcare side of things, which is quite substantial. We always talk about centers of excellence. If that's not a center of excellence, I don't know what is. So it's really quite impressive. And we're very proud of the nursing program here. I've been on the job, as Paul said, for what, 4 months, 2 weeks, 3 days, 2 hours. But who's counting? Who's counting? But one of my promises and commitments to faculty and to students was to attend classes, 2 classes per month per semester. And one of my favorite classes that I attended was Kathleen Kennedy's. I always say it was my favorite, but this really was my favorite, Kathleen. Was one of Kathleen Kennedy's classes, labs actually, and I think it was on patient evaluation, and I was struck by a couple of things, and one was it was incredible, first of all, how gifted the faculty are in transferring their knowledge and teaching our students, and our students. I was so impressed with how excited they were to be in the class and to be in the lab. But I was really struck, quite honestly, about how much had to be learned in a 3-hour lab. There was like 5 hours worth of work that had to be done in a 3-hour lab, and I would have never have made a nurse because I would never have passed. We have about 1,000 students registered in nursing programs at this college right now, 420 alone in Kingston. Phenomenal amount of students. And I think Janine was telling me that we have something like 3,500 nursing grads. So in this area. So the chances are that if you've received health care, if you've had health issues, if you've needed a nurse in attendance, chances are you were dealing with a St. Lawrence College grad, which is something that we're very, very proud of here. One of the things that I've been asked to do by my good friend and colleague Gordon McDougall, who is also a nurse and one of the senior vice presidents on our team, was to pay acknowledgement to Clare Rayner. I know I'm not supposed to do this, but I'm doing it. And he wanted me to do it for a couple of reasons. One, he wanted to acknowledge and center you out, and he is centering you out here. But was for the leadership, the 7 years that you spent together as office partners and office mates. You were his coach, his mentor, and he would tell you all this, but he can't come up here right now. And I got to tell you, Claire, I've spent 10 years with him in the same hallway, so I can't imagine 7 years in the same office. You have a whole new amount of respect. But we would like to thank you and the entire committee for the tremendous amount of work that you've put into this event, and I'm glad it's packed here. It's a testament to you and the committee, so thank you very much. So in closing, I just, again, welcome, and just want to say thank you for your contributions to the college, and we are incredibly proud of you. Enjoy the rest of the afternoon and enjoy your evening. Thank you.
Thank you, Glenn. I now have the honor of introducing to you Rose Bell, who, in reading her bio, she seems to be, if we were to do a museum panel that talked about the progression of nurses from one end of the story to the other, I think Rose encapsulates that story very nicely. Rose has been the Associate Dean of the School of Health Sciences here at St. Lawrence Kingston campus since 2007. She started her career in nursing 40 years ago, so 1973, when she graduated as a practical nursing assistant with the last graduating class from KGH. Therefore, this year's 40th anniversary celebration, past and present, has special meaning to her personally. She received her registered nurse diploma in 1978 with St. Lawrence College as part of the Diploma Nursing Modular Program. She obtained her nursing degree through Queen's University in 1990 and has a Master in Public Administration through Queen's University in 2004. She's had a diverse career in senior administration within the municipal and provincial governments, as well as the not-for-profit sector. She has worked at the Victorian Order of Nurses, Eastern Lake Ontario Branch, Kingston General Hospital, Providence Continuing Care Mental Health Services, chronic care, and long-term care. Her past experience includes teaching positions at Queen's University and here at St. Lawrence. Rose has an interest in current healthcare practices and issues within the healthcare sector and supports positive outcomes for students within the health sciences programs. Her personal philosophy is that education should offer students a balance between the theory and the experiential. She regards this as an integral aspect for lifelong learning. Please join me in welcoming Rose.
Thank you very much. I'm very pleased to be here with you today. And on behalf of the School of Health Sciences, St. Lawrence College, I would like to welcome you as well to the 40th anniversary celebration. And after 40 years of personally working in the nursing profession, I call today, looking at all these displays and seeing everyone here, a journey down memory lane for me. On behalf of St. Lawrence College and today's participants, I would like to extend also my gratitude to Clare Rayner. Clare is a professor in the practical nurse and degree nursing programs at St. Lawrence College. And this past year has been a journey of love for Clare, who has been the champion of this celebration. We would not be here today without her determination, her dedication, and leadership. And I am sure that many of you know Clare as her student, her colleague, and her friend. Thank you, Clare. Secondly, I would also like to thank the organizing committee. This has been a dedicated and determined committee whose love of the nursing profession has brought you today's histories and memories of the past 40 years. Many of the committee members participated in the move of the nursing programs from the hospital to the college setting. I would also like to thank the Museum of Healthcare for supporting the profession of nursing and for capturing our nursing history in such a sensitive and warm environment. As the flyer says, the museum brings Canada's, and I think specifically Kingston's, healthcare story to life. I would also like to take this opportunity to thank the student volunteers out there who have assisted us today. I am proud to have been asked to speak to you today, my friends and my colleagues. During my nursing career, you have been my mentors, my inspiration, and my support. Today is a day of reminiscing, a time for reflection as we ask, and I specifically ask, has it really been 40 years? As nurses, we have different memories. We have traveled different paths in our career. As nurses, our lives are intertwined with our career. Just ask our families. We have balanced our career with our families. We have had many joys and some heartaches, personally and professionally, along our path. Yet our dedication to the nursing profession has never wavered. We are committed, we are passionate about advocating for patients' rights, and we believe in the provision of compassionate care for our patients, our clients, and for the families who love them. It is fitting that this year's theme for Nursing Week is Nursing a Leading Force for Change. As nurses, we have lived the changes in the healthcare system that has evolved over the past 40 years. We have all been impacted at various times in our careers by cutbacks, by reorganization, by downsizing, by changes in roles, changes in responsibilities, changes in scope of practice, changes in locations, and job changes. Our lives have changed over these past 40 years. We have advocated for better health care. We have been on the picket line together. We have traveled through snowstorms and ice storms to provide care. As your colleague, I am proud to have known so many of you in so many different aspects of nursing. We have made this journey together over the past 40 years. Now it is time to support the younger nurses who will be the champions over the next 40 years. I believe this is our responsibility. It is our legacy to future nurses. On behalf of your patients, your clients, your students, your families, your colleagues and friends, thank you for choosing nursing as a profession. You have made a difference in the lives of many people in your nursing career. Your journey has brought health and happiness to the lives of the people you have touched. You have been the healing hands, the supporting hands, the hands of strength. Today is an opportunity to enjoy your celebration and share your memories of your nursing profession. And I have a memory now I would like to share with you. This is my walk down memory lane. When I was in my first year of nursing at Kingston General Hospital in the practical nurse program, we had to, as everyone does, learn to make beds. And it was in the Ann Bailey building, and the beds were big, they were tall, and the mattresses were like that thick. But we could make great beds. We could pull those sheets so tight you could flip a quarter on them and they would bounce, and we were good at it. I practiced and practiced with my classmates. We were great, we were ready to go. So what we had to do then was walk across the street to Kingston General Hospital and make beds in a patient's room. So I was assigned my patient's room, and my patient was sitting in a chair, this elderly gentleman, and I had to make his bed. So I thought, I can do this. And I looked at the bed, and I looked at the mattress, and the mattress was about this thick. So I thought, okay, I took away the linen, you know how you carry it away from you, disposed of it, washed my hands, and went back to make this bed. I tucked in the sheets, I had everything, those corners, they were perfect. So I get around to the other side of the bed to straighten the sheet, and I gave it the same tug as I did on those great big high mattresses at Ann Bailey, and it all came off the other side. And I went, oh, what did I do wrong here? So I had to race around to the other side of the bed, and of course I did the same thing. I tucked it down hard to get that tight so that I could flip that quarter on it. But it just kept coming out. And of course I was getting hotter, and the poor gentleman was looking at me. And so finally I got the bed together, the bottom sheet. It wasn't as nice and tight as I would have liked it, but I did the best I could do. Because the gentleman said to me, "Nurse, when can I get back into bed?" And I went, I only got the bottom sheet on. Oh, soon. So then it was the top sheets. And of course, at that time when you were making the bed, you had to make sure that the ridge of that top sheet was not against the patient, right? Remember that? Do you think I could find where the ridge was? So I'm feeling the sheets. Where is the ridge? Which side is it that I have to keep away from the patient? I went down to the other end of the sheet to see if I could find it at the other end of the sheet, and I couldn't find it there either. So I thought, well, I just have to guess. I just have to put it on. So I did, and I made the bed, and it didn't look too bad. I was pretty proud of it. I had my corners down pat, so I thought, well, now it's time to go out and get my clinical instructor and have her come in and give me the final word of approval. She comes in, she goes over to the bed, she picks up that sheet, and she says, "You have the sheet facing the wrong side down." She said, "Do it again." Enjoy your evening, thank you.
Thank you, Rose. Now, in some respects, I should feel exactly like Rose did when she was making that bed, introducing the gentleman who was my boss for 7 years, because I wrote this myself, so if he cringes with what I say, bear with us. I now have the honor of introducing Dr. Jim Lowe. Dr. Lowe has been involved in some aspect of healthcare for pretty much his entire professional life. A graduate in medicine from the University of Toronto, Dr. Lowe's career brought him to Kingston in 1965, where for 20 years he was professor and head of the Department of Obstetrics and Gynecology at Queen's University and Kingston General Hospital. His research in maternal and fetal health has received wide recognition in the profession. One could describe the second phase of Dr. Lowe's career as having begun when he was bitten by a bug, from which he has never recovered. I speak of his love for history and the material culture of health and medicine in Canada. Dr. Lowe, who founded the Museum of Healthcare in 1991, remains to this day one of its driving forces. During his 20-year tenure as manager and later executive director, all of this as a volunteer, he relocated the museum to its permanent home in the Anne Bailey Building National Historic Site, the former nurses' home at KGH, and was the sturdy backbone behind what has become an impressive facility, still the only mission-specific museum of healthcare in Canada. Dr. Lowe has been honored many times for his contributions in healthcare, education, and heritage. In 2012, he received the Queen Elizabeth II Diamond Jubilee Medal, and in June of this year, he is to be honored with the Partners in Research Ronald G. Calhoun Science Ambassador Award, an award recognizing outstanding healthcare leadership and outreach activities which have contributed to the enhanced public understanding of the importance of health research. Please join me in welcoming Dr. Jim Lowe.
Thank you very much, Paul. I can assure you that my speech is going to be shorter than the introduction. However, I'm really here on behalf of the Museum of Healthcare and to extend our congratulations to Clare, who I view as a friend. Now, she didn't tell me what I had to do today. And producing the program that we are engaged in at the present time and look forward to. The issue is that here in Kingston we have a unique opportunity. Museum of Healthcare, as Paul said, was developed simply because there is not a mission-specific Museum of Healthcare preserving the legacy of the 40 disciplines that make up healthcare today. And that, of course, is our first mission. But our second mission is to use that resource in order to help people understand the history and science of health and healthcare that has developed over the last 200 years. The reality is that the past gives perspective to the present and gives us some insight into what the future may be. What was achieved in the past is in many respects as remarkable as what we are achieving today, recognizing the resources that they had at that point in time. And Kingston can tell that story from a point of view of nursing probably better than anyone else. The Kingston General Hospital School of Nursing started in 1886. The Psychiatric Hospital School of Nursing started in 1888. The Hotel Dieu Hospital sisters were nursing from 1845 until the St. Joseph Nursing School was opened in 1912. And the University Bachelor of Science program established early in 1942. There is a long history of nursing here in Kingston, which is equal to anything that's available anywhere in Canada at the present time. And this opportunity for the schools of nursing to tell that story is, I think, very important, because they can tell it as well as, if not better than, most people can. And the programs that we've had so far from the Kingston General Hospital Nursing Alumni and from the Hotel du St. Joseph's School of Nursing have, in my judgment, been outstanding. And I look forward to this one being equally outstanding. So my congratulations to you, Claire. I think you and your committee have worked very hard, and I really look forward to see the rest of the program. Good luck. Thank you very much.